po. So I will be doing po is bed making, which is unoccupied. So first po, I will now sample equipment and arrange on a bedside chair in the order in which items will be used po. So organization facilitates performance of task. Then next po, I will now perform hand hygiene and also put PPE as indicated po. Hand hygiene po and PPE prevents the spread of microorganism po. PPE is required based on transmission precautions. Next po, I will now adjust the bed to a comfortable working height. So, sa pag-adjust po ng bed po is having the bed at the proper height po prevents po yung back and muscle strain. Then I will now disconnect cold bell or any tubes from bed linens. So, disconnecting devices prevents damage to the devices po. Next po is I will now put on gloves. So, gloves prevents the spread of microorganism, and I will now loosen po all the linen po. Next po is fold reusable linen such as sheets, blankets, or spread. So, first po, I will now take this off muna po. So, ito po is lalagay ko po sa clean chair po. So, folding saves time and energy when reusable linen is replaced on the bed po. So, snugly rolled all the soil po. So, first, I will sanitize po ulit yung hands ko. So, rolling sided linens po, snugly and placing them directly into the hamper po. So, tatanggalin ko muna po lahat. So, agad-agad ko rin po siya ilalagay sa laundry hamper to prevent po yung mga ibang contamination. Then next po, if possible po, shift mattress up to head of the bed. Okay, this allows more. If you simply place the draw sheet when extended fold in the center of the bed po. So, if possible din po, prevent din po natin siya na may lagay sa floor. Then, put the bottom sheet po over the corners, which is yun po yung naginawa ko kanina. Then, next po is move to the other side, which is na-secure ko na po yung mga bottom ng, sa kama para po mas tight and secure po sa patient. The next po is place the top sheet on the bed. So, bago ko po yung muna ilagay yan is, I will put this po, yung para po ma-prevent yung for waterproof po sa mga ihi ng patient. Ganyan. Then, ito na po yung sa place the top sheet po on the bed. But before I do that po is, I will now put pillow sheets muna po din sa pillow. Then secure din po natin yung sa mismong pillow. Then ito na po yung pinaka-top ng sheet. The next po is top sheet po and blanket under the foot, which is yung nagawa ko na. This saves times and energy and keeps the top line linen in place po. Then, ma-fold ko na po yung upper. Okay? So, move to the other side, which is yung same procedure din po na ginawa ko dito kanina and gagawin din po sa isang side. So, working on one side po is out the bed. At this time, saves energy and is more efficient po. So, place the pillow on the bed din po. So, open each pillow case. Ayan. Same manners as you open other linen. So, fan fold or bifold, nagawa na rin po natin yan. Having linens open makes it more convenient for the patient to get into bed. So, next po, I will now secure signal device on the bed according to the agency policy. Next po is, i-release ko na po yung mga side rail. So, isa-secure po natin dyan yung mismong patient. So, dispose na po natin lahat po ng soiled linen, which is yung mga kanina. Then, I will now remove my PPE. Then, ituthrow lang din po natin yan sa mismo proper trash can to avoid po yung mga transmission ng bacteria po. Then, I will perform hand hygiene din po. And good afternoon po. I will be doing po is bed making, which is occupied. So first po, I will now check charts for limitations po sa patient's activity po. This facilitates patient cooperation, determines level of activity po, and also promotes po yung patient safety. Next, I will now assemble equipment and nilagay ko po siya sa bedside ng chair. So perform hand hygiene and put PPE as indicated. Ganyan lang. Wait lang. Saan ba tumawa? Ay, identify mo. Ay, rational mo. Ayun. Hindi dyan. Wala kami patutod ko kayo eh. Hindi na ganyan kanina, no? Hindi na. Ayaw mo na? Nakikita yung lagot ka na. Hand hygiene and PPE po prevents the spread of microorganism. Now, I will now identify the patient. Hi po, ma'am. Good afternoon po. I am Samantha, your student nurse for today po. From 6 a.m. to 6 p.m. Ma'am, may I know your name po?
My name is Claire Steyan G. Ramos,
Age,
19 years old,
birthday po.
November 9, 2006.
Can you check your ID man po so I can confirm? So, patient's identification validates the correct patient and correct procedure po. And also, discuss po yung mga gagawin po natin. So, ma'am, yung gagawin ko po is i-occupy ko lang po itong bed. Is it okay po?
Yes.
Okay. Now, as you can see po, I close the curtains for the privacy. So, adjust the bed to a comfortable working height po. So, having the bed at the proper height prevents back and muscle strain po. Okay? So, lower side rail nearest you, leaving the opposite side rail up po. So, dito po, let's assume na meron po tayong naka-raise na rail po. Then, naka-low naman po yung dito. So, having the mattress flat, make it easier po to prepare a wrinkle-free bed. Now, I will put gloves po. So, gloves prevents the spread of microorganism. Then, check ko din po if baka mayroong mga personal items sa patient sa mismong bed. So, wala naman po. Next po, place a bottle blanket over the patient po. Ma'am, pahawak po dito sa tulog. Then, the blanket provides warmth and privacy po. Placing linens directly into hamper prevents the spread. So, gagawin ko muna po is, aalisin ko muna po yung kumot niya sa bottom. Then, kaagad po natin siyang ilalagay sa laundry hamper po. So, if possible po, another person is available po to assist, grab smart stress, and securely and shift it up to head of bed. So, assess patients to turn toward opposite side of the bed. So, ma'am, ganun muna po kayo. So, gawin nyo lang po is, lagay nyo po yung kamay nyo dito. Then, nakaganyan. So, iko-cross nyo po yung paa nyo. Okay. So, ilagay nyo po yung kamay nyo dito sa side tray. Then, loosen all bottom linens from the head, foot, and side of the bed. So, I will remove my gloves muna po. Para po malagay yung clean linens po. Another bed sheet for the patients. So, I will sanitize my hands again. So, we must secure din po yung sa side po ng bed. Then, para hindi po tayo mahirapan, ilalagay ko na rin po dito. Then, next po, I will be doing po is yung, so for waterproof, pag iihis si patient. Then, yung pinaka-top sheet po. We must ensure din po na naka-secure tightly din po to. Then next po is babalik po ulit si patient sa mismong person na kanina. So ma'am, sige. Position muna po kayo. Then next po is, itataas ko na po yung place dito. Yan. Then I will put my gloves po. Para sa mga matutunging bedsheet po. So kapag po nakataas na po yung sa kabila, ibababa naman po natin yung another side. Then ma'am, another position po ng kamay. So ganun muna po. Okay, then, sige po ma'am, side po kayo. Wait lang po. Wait lang po. We must ensure din po yung warmth and precipitation. Sige ma'am. Ma'am. So we must ensure po na ilalagay din po natin siya sa smooth concrete to prevent contamination po. Then, I will remove again my gloves po. Then, itatapon po natin siya sa mismo basurahan. Then, I will also sanitize my hand po. So, kung ano din po yung ginawa ko kanina sa side na yun, is gagawin ko din po sa side dito. Then after that po, we must secure din po ito. Tapos ilalak ko na rin po yung dito sa kabilang side, i-release ko na po yan. Babalik ko po sa position of exhibition. So, sige ma'am. Okay. The next po is sa bed niya, sa una niya naman po. Okay. Tatanggalin ko din po ito. Ang papalitan ng bago. Okay. Sige po. Then after that, return si patient to a position of comfort. So, promotes patient's comfort and safety po. So, dispose of soiled linens according to agency policy. So, i-remove ko na rin po yung mga any other PPE if used. So, removing PPE properly reduces the risk of infection, transmission, and contamination of other items. Then, hand hygiene prevents the spread of microorganisms. So, dispose ko lang din po sa tamang lagayan and I will sanitize again my hands.